Hi everyone, welcome to Imaging Study. Today we are going to see a case of dengue fever. I'm working in a dengue dedicated hospital right now, so many dengue cases are coming here. Let's see the ultrasound findings of dengue fever. An 8-year-old male child came with fever, weakness, positive NS1 antigen test, which is antigen test for dengue fever, and low platelet count. Let's see what we have got on ultrasound. Here you can see the right lobe of the liver showing the gallbladder. The gallbladder lumen is clear, but the wall is thickened and edematous. If you magnify the image, you can easily visualize the hypoechoic thickening of the gallbladder wall, indicating edematous change. Here you can see the ligamentum teres regions appear edematous also, mimicking a worm. Edematous gallbladder wall and also surrounding edema is very common in case of dengue. Now let's check the diaphragmatic region, and you can see there is mild collection at the right pleural cavity, obliterating the right mirror image artifact, indicating right-sided pleural effusion. The hepatic ecotexture looks normal, however the liver size was slightly enlarged, measuring more than 11 cm in mid-clavicular line. Here is the image from the left hypochondriac region showing a mildly enlarged spleen. You can see mild collection is also seen at the left pleural cavity, obliterating the mirror image artifact on this side, indicating left-sided pleural effusion. Here is the image from the right iliac fossa. As a dependent part, you can see an anechoic area outside the bowel lumen, indicating mild peritoneal collection. Very trace amount of collection was also seen on the left iliac fossa, though the picture is not available here. So here's the picture of the slightly enlarged liver and right-sided mild pleural effusion. On the right, you can see the edematous thickened gallbladder wall. The wall thickness was around 6.6 mm. More than 3 mm is indicative of thickened gallbladder wall. Here is the picture of the mildly enlarged spleen. The baby is of 8 years old and 8.4 cm is considered as mild enlargement at this age. Left pleural effusion is not well visualized here, however we have seen that on the video. Here's the picture from the right iliac fossa, and you can see mild collection indicating mild ascites. So in summary, in this dengue case, we have seen mild hepatosplenomegaly, thickened edematous gallbladder wall, mild ascites, bilateral mild pleural effusion. These features are very common in dengue cases, especially in those patients who come with dengue hemorrhagic fever or dengue shock syndrome. Now the take-home message. All these features in a patient suffering from dengue fever suggest plasma leakage, where the patient may anytime need intensive care unit support. So be careful about these patients. We usually hospitalize them and monitor vital signs and biochemical markers for further management. Thank you for watching this video. We also have posted another dengue fever case on our ultrasound case discussion video from June 2021. I'll put the link of that video on the description box so you can check that. Expect some dengue cases in near future as we are getting a lot of patients. Don't forget to subscribe our YouTube channel and see you on the next one. Have a nice day.